Hi, it's Dr. Halm. It is Monday, September 17th, and just a quick update this morning. So we are finishing out week 2, headed into week 3. I had a chance to look over everyone's Typhons records this morning. Glad to see that everyone's starting to get their hours in. And you should start to feel over the next couple of weeks a little bit more comfortable every day when you walk in. It can be a little bit anxiety provoking, being in a new place and kind of getting used to things and getting settled, but that does get better over time. So again, what we're looking for is that as the days tick by, you take on an increased amount of responsibility and decision making in your patient, and make sure that you're noting that maybe it's shared 50-50 care in the Typhon system. Let's see here. So we're finishing out week 2, nothing there. As we head into next week, you're going to do the same things as far as hours and logging your clinical patients. You do have one brief assignment here. We're going to have you look over this SOAP note and make notes about the good, the bad, and the ugly of this SOAP note, and then when we're in class we're going to look it over together. So I expect you to print off the note and highlight the things that are missing, etc. And this will be a great practice for your first note that is due then the next week. And then start thinking about a couple interesting patients that you've seen, some things that you learned that maybe were new concepts to you that other students would really benefit from learning about. And then next week also bring 2 clinical notes that you can share with me so I can see what kind of documentation you're using. As always, make sure that the document that you give me doesn't have any patient identifiers on it, which will probably mean that you'll need to cut off their medical record number, their name, any kind of data as far as their name, address, things like that. Just you can physically cut it off the page or use dark black ink. Anyway, hope things are going well. If you have any questions, just shoot me an email. Otherwise, we'll be seeing you next week.